Uma, you are on mute. Uma?
Good evening, all respected team dietitians of CNF. Our esteemed speaker for the day, Dr. George Chandy, sir. I am Uma Kalyani, Secretary of CNF Kerala, Community Nutrition Forum Kerala. Community Nutrition Forum is a platform, dedicated platform of clinical dietitians and nutrition professionals committed to promoting healthy eating and sustainable wellness among the public. Since our inception during the pandemic, we have actively conducted several impactful initiatives, including group sessions, webinars, and a 10 hours long webinarathon recognized by the Universal Record Forum. Our team also does evidence-based researches. Today, we are proud to have a strong network of 300 dietitians, nearly 300 dietitians across Kerala, fostering public awareness and professional collaboration. Our founding trustees are Mrs. Sharon Thomas, Dr. Sri Priya Shaji, Mrs. Jyoti James, Mrs. Sonia K. Joseph, along with myself. With the support of our dedicated office bearers, including our newly joined Joint Secretary, Dr. Jyoti Krishnan, along with the executive members and our vibrant team of dietitians, we continue to work towards spreading accurate nutrition knowledge to the public. Now it is my privilege to invite Mrs. Sharon Thomas, President of CNF, to deliver the presidential address. Thank you. Did you please unmute yourself?
Respected Dr. George Chandy, sir, dear colleagues and all respected participants. Good evening to everyone. I am very happy to welcome you all to today's webinar on the gut microbiome and nutrition. Today, we all know that we all understand that the gut health plays a very important role and in our overall health, the connection between gut microbiome and immunity and metabolism, mental health, and many diseases becoming very clear, as Sir said, with research. This is bringing an important change how we practice clinical nutrition in our daily practice. So today we are really truly honored to have with us Dr. George Chandy Matetra, Director and CEO of Belivers Medical College Hospital. Despite his very busy schedule, he has kindly taken to be with us and share his valuable knowledge. I have personally had an opportunity to listen his talk at last year conference at Belivers Benefest, and it was truly inspiring. We are indeed fortunate to have him with us today. I'm sure today's session will give us a very useful insights for our clinical practice too. Now I invite Dr. Jyoti Krishnan, Chief Dietitian at Belivers Medical College Hospital and Joint Secretary of CNF to deliver the welcome address. Thank you.
Thank you, Sharon ma'am. Good evening all. It is a true privilege and a moment of great pride for me to warmly welcome our beloved director, Professor Dr. George Chandy sir, to the Dietopedia today. Sir, to us, not just an exceptional clinician or an accomplished leader, is a mentor, guide, and a constant source of inspiration. Sir's journey, marked by excellence, humility, and service, reminds us what it truly means to dedicate one's life to healing and to humanity. Professor Dr. George Chandy Matetra is a distinguished gastroenterologist, academician, and healthcare leader with decade of experience in the clinical care, medical education, and hospital administration. He has played a pivotal role in advancing hepatology and liver transplantation in India, while contributing significantly to research and public health awareness. Sir is a former director of head of the Department of Gastroenterology and Hepatology, CMC Vellore, has been a pioneer in the field of hepatology and liver transplantation in India. Sir is a recipient of many prestigious honors, including the Dr. B.C. Roy National Award from the President of India for excellence in healthcare leadership and contributions. That is the highest recognition in the medical field in India. Sir is the Doctor of the Year of, he has received the Doctor of the Year award at CMC Vellore and several other accolades. What touches us deeply is Sir's spirit of servant leadership. Lead with compassion, always placing people before position and service before recognition. In every decision, we see his genuine care for the patients, students, and all of us. Sir's previous positions in the administrative and clinical setup is he was the medical director of MIOT hospitals, uh, Dr. MGR University, Tamil Nadu.
You're muted, Jyoti. Please unmute yourself.
Fellow in hepatology and liver transplantation, Royal Prince Alfred Hospital, Sydney. And he has wrote several books and book chapters. And recently, the last year, he has wrote the first chapter for the book produced by Dr. N.K. Ganguly. Sir is the former director of ICMR. And he has also authored, he has a mentor author for one of our book, Diabetic Delight, actually funded by ICMR. And sir is it is my truly it is my honor and privilege, and I'm truly blessed at this time to work under his leadership. And he has also published more than 100 plus articles in several international and national journals, and sir has got several awards for his in previous years, and even in Belivers also he has received several awards. And I feel truly blessed to work under his leadership, and your encouragement motivates us for the vision and inspires us, and your humility teaches us every day. On behalf of everyone present here, especially Nutrition Community Nutrition Forum and everyone present here, I extend a heartfelt welcome to you, sir, and we are deeply honored for your presence. And also I welcome all the participants on behalf of CNF to this program. Sir, now I request you to take over the session. Thank you.
Jyoti, thank you so much for those kind words. Thank you for the opportunity and the privilege to work with you at the Belivers Hospital. To Uma, Sherin, the founders of CNF, the executive committee, thank you, CNF, for having invited me to share some of my thoughts with you. Actually, this whole journey for me started 2 years ago when Professor N.K. Ganguly invited me to give a talk at a meeting in Trivandrum. Just before that, I was fortunate to meet up with one of my junior colleagues who was with us in Wellcome Research in Vellore, who had become the director of the laboratory at the All India Institute of Medical Sciences in Bhubaneswar, where he was doing a lot of good work. Only thing is, he said at the end of it, he said, I feel I'm doing all this work, but there's so much money in this that I'm wondering, what am I doing basic research? So this is the whole dilemma and problem. There is so much excitement about things that are happening, but there's also the monetary benefits, which I think many of you have chosen not to get attracted to, and my Jyoti is one of them, building up a fantastic department for us at Belivers Hospital. The gut microbiome, nutrition, and the ever-widening clinical revolution is something that has taken the world by storm. It's also something that all of us should get excited about, interested in, because one small step for man became a giant step for mankind when Neil Armstrong in 1969 landed on the moon. So metagenomics, which is the genomic study of these organisms, have taken a place for itself in the field of science. And it was Eli Mechnikov, the father of probiotics and a Nobel laureate, who said that the majority of diseases begin in the digestive tract when the good bacteria are no longer able to control the bad bacteria. Many years ago, I think it was about 40 years ago, when I joined the Welcome department as part of gastroenterology when I did my training and then went on to work in the department at CMC Vellore. One of the things that we were taught was that look at the villi of the Indian public. How do you look at it? Those days you had to pass a tube right down, get it down into the jejunum, and you take it a tiny bit, pull it out, take out the juice, examine it. Very arduous. But what we found was very interesting, that the crypt to villus ratio in the Indian person was about 3:1. The equivalent in a person from Europe or from America would be 5:1. Okay? So what happens, we know that the villus is the area that helps, the surface that helps in the absorption. So 5:1 to 3:1. See the difference? നമ്മുടെ എല്ലാവരുടെയും intestine-നകത്തുള്ള absorptive surface is so much less. So we embarked on a project where when Europeans, when Americans came to our department, we would do a biopsy. And we do a biopsy at the end of a year when they return after their study leave. We did the reverse as well. ഞങ്ങളൊക്കെ abroad പോകുന്നതിന് മുമ്പ് we had biopsies taken and a repeat biopsy when we came back. We found that the time we spent in India, in Vellore, resulted in the stunting of the villi. And when we went abroad, our villi grew. Just see the difference it makes. The absorptive surface in the Indian or the South Asian population is much less than that of a European. So this got us thinking, and we started looking, because we were at that time endemic for tropical sprue. We were looking for the tropical sprue cause. We were looking for viruses. We were looking for bacteria that may be causing it, but at least it gave us a kind of understanding that something is happening within the gut that affects all of us. So we knew that there are bacteria, viruses, fungi, and parasites that are involved. And now we know that the gastrointestinal tract has a huge surface area, and about 60% of all these organisms are found in the GI tract, in the oral cavity, in the skin and eye, and also a little bit in the genitourinary tract. And now we've been able to try and name all of them. 40 major species comprise of all the 99% of the bacteria, and we've got them all well named. Now, I want to introduce you to two terms, the microbiota and the microbiome. Microbiota deals with microbial cells, which is an assemblage of all microorganisms in the environment, bacteria, fungi, viruses. And the collective of the genomes of the microbiota are what are called microbiome. So we now know that these changes happen right from birth. So a lot of factors impact the number and the composition of what we live with, the gut microbiome. And we also know that the number of these organisms are much more than the number of our cells within our body itself. So here are 4 terms that are good to remember. One is called metagenomics, which is actually the composition of the community, and we do it through DNA extraction. The second is metatranscriptomics, which deals with the functions of each species within the community, which is done by mRNA extraction. Metaproteomics, which is done through protein extraction, talks about the immediate catalytic potential. And for the overall metabolic state, we do metabolomics, which is the metabolites extraction. So when you look at the functions of the gut microbiome, there are the metabolic functions, the immune development, the neuroendocrine functions, the crosstalk between the gut microbiome and the host, and the colonization resistance as well. One of the things that as a hepatologist, as a liver specialist, that we always knew was that if we are not careful, when a patient goes into liver cell failure, that means the liver is failing, there is a shunting of the ammonia away from the liver and going to the brain. And we also knew that with a high bacterial load, these patients become extremely sick. So when a patient with decompensated liver disease presents to the emergency, the first thing we do is to do an enema, get rid of all the bacteria with the stool. And then we go on to giving antibiotics to get rid of the rest. So this is something that we have practiced for maybe 100, 200 years without quite understanding the whole purpose of why we did what we did. And now we've got a wonder drug called rifaximin, which when we give it for patients with liver disease, it helps to control or get rid of the unnecessary bacteria. And this was proven in a trial called the RIFSIS trial. So this drug has become a very popular armamentarium for us liver specialists. The other thing that all of us know is what we always say, a gut full of gas. When you feel full, uncomfortable, so many patients come with this. It's usually due to an increase in the small intestinal bacterial overload and presents as what we call the IBS or the irritable bowel syndrome. Here again, we have very effective drugs now. The one that I use a lot is this VSL3, which is live freeze-dried lactic acid bacteria. And that supplies good bacteria within the system after we've got rid of all the bad bacteria with antibiotics. What is the role of the microbiome in gastroenterology? Those which are very well established is with Helicobacter pylori and ulcer, infections within the small bowel, antibiotic-associated diarrhea, Clostridium difficile, what I just mentioned, small intestinal bacterial overgrowth, what I said earlier about hepatic encephalopathy affecting the brain, and septicemia, both due to gallbladder or to pancreas. Some of the roles where this is postulated is in functional dyspepsia, diverticulitis, IBS, inflammatory bowel disease, celiac disease, and CA colon. There are a lot of studies being done in metabolic syndromes, in neurological conditions, in autism, depression, in cancers, and in autoimmune disorders. So what has happened now is that we gastroenterologists have been given a higher position in the medical world, so to speak, because the gut is being now described as the second brain. Neurologists were always ahead of us, but now we have, sometimes we say that, yes, we are also there with you. So then we come to the gut brain axis. And we know that when you feel uncomfortable in your stomach, it may be due to stress, it may be due to motility problems, but all these things need a lot of discussion. Today, we know about the microbiota gut brain axis with the lungs, with the liver, with the heart, with the kidney. There's not any organ left where there is no connection that is being postulated or discovered on an annual basis. There's a lot of talk about the gut immune axis. That means all the autoimmune diseases. Let's look quickly in the area that you all are very specifically interested in, the gut microbiome and the micronutrient dynamics. And we know that definitely there is a lot happening in this area. In 2007, in Nature, Peter Tronberg talked about the human genome and mapping the blueprint of human life. And we are now in the process of looking at the micronutrient biosynthesis, the uptake, the absorption, and the secretion. And we can now confidently say that the gut microbiome functions as a key regulator of host nutrition, immunity, and metabolism. Micronutrients, including vitamins and minerals, are essential for microbial and host cellular processes. And we need to remember that this is a two-way relationship. The food that we take shapes the microbiome, and the microbes aid nutrient absorption. And we know about symbiosis, a positive result, and a dysbiosis. Therefore, a balanced microbial community results in symbiosis, but wherever there is imbalance, results in dysbiosis. This is what is going to be your biggest challenge when you advise your patients on the nutrition that they need to go to. It is a bidirectional interaction. The microbiota influencing the bioavailability, synthesis, and the metabolism of nutrients, and the micronutrient intake in turn shapes the microbial composition and the function. So, what are some of the multifaceted roles of the microbiome in nutrition? Short chain fatty acids, vitamin synthesis, modulation of bile acids and cholesterol, enhancement of mineral solubility, regulation of mucosal integrity and inflammation, a number of very key important roles that it plays. When you look at macronutrients and microbiome, you have the fiber fermentation, you have the role in protein and its byproducts, and the fat. Dietary fats significantly alter bile acid metabolism and leads to changes in composition. Must remember the dysbiosis can impair nutrient availability. We must look at the vitamins. We must look at the minerals where absorption is affected by microbial activity and the pH. We now have enough information of the role of these organisms in short chain fatty acid production, in polysaccharide metabolism, folate and B vitamin synthesis, and you have the organisms that we know results in the processes that we've talked about. And we need to remember that imbalanced mineral absorption due to gut dysbiosis It can result in iron, the lowering of iron supplementation. You need high doses can cause dysbiosis. Zinc deficiency decreases microbial diversity, and magnesium deficiency leads to gut dysbiosis and anxiety as well. So the folate, riboflavin, B12, and biotin, there are specific organisms that have a role in their metabolism. Let's look at some of the vitamin effects on the gut microbiome. B complex produced by bifidobacteria and lactobacillus. Riboflavin supplementation decreases Enterobacteriaceae in Crohn's disease. Vitamin C enhances the microbial diversity and the short-chain fatty acids. And vitamin D promotes the growth of some of the organisms that lead to immune regulation. Vitamin A leads to dysbiosis and mucosal damage. And vitamin E has several activities on some of the organisms, but oversupplementation affects the bone metabolism, and we have to look at the dosing then. So here is a big, busy slide with a whole lot of information about the gut microbiota, which can synthesize and modify several vitamins. And we know now we have enough data which tells us about the vitamin bioavailability and which causes dysbiosis. Let's quickly look at some of the key clinical implications. We know that nutrient deficiency and dysbiosis has a big role to play in inflammatory bowel disease, in celiac disease. B12 and folate deficiency are particularly frequent in dysbiotic conditions, and iron and zinc malabsorption occurs secondary to mucosal inflammation and microbial imbalance. How do you do some therapeutic modulation based on this? Probiotics and synbiotics can enhance micronutrient bioavailability. Prebiotic fibers promote short-chain fatty acid production, and fecal microbiota transplantation and targeted microbial restoration show promise in correcting nutrient-linked dysbiosis. CMC Vellore, Belivers, and AIMS Bhubaneswar under Dr. Balmurugan did a trial study, and we found that the curd that we use, the evaluation in the investigation showed us that the maximum organism count that we get is at 14 to 16 hours after ഒറ ഇട്ട് കഴിഞ്ഞിട്ട് 14 മണിക്കൂർ 17 വരെയാണ് ഏറ്റവും മാക്സിമം നമുക്ക് ഓർഗനിസംസ് കിട്ടുന്നത്. So we now advise our patients when they come, എന്ന് രാത്രി 9 മണിക്ക് please put the aura and have it fresh the next day with your lunch at 1 o'clock. This has really shown remarkable results. The only thing is, we'll find that many people will go into using this as a method of earning a lot of money because it's a simple thing to do. I hope we keep it simple. So what is the role of gut microbiota in some of the clinical disease dynamics? We know about homeostasis of the gut microbiome, and we know the numbers now, the percentages of each organism that results in a good relationship. And we also know that when the numbers are different, when the composition is tampered with, you have what is called dysbiosis. We see this in several conditions: diabetes, in autism, in colorectal cancer. and in a host of chronic diseases where they have studied the gut microbiome, the numbers, as well as the composition. We now know that there are changes that occur which can exacerbate type 1 diabetes, eczema, asthma, IBD, IBS, cardiovascular diseases, chronic kidney diseases. And we are now in the process of doing further studies to see, can we manipulate? Can we make sure that the numbers are right, the compositions are right, so that we can control these diseases? What is the level of interaction? So changes in the gut microbiota strongly impact the liver. So when there is dysbiosis and systemic inflammation, there is disease progression in alcoholic liver disease, in hepatocellular carcinoma, in viral infections, in cirrhosis, as well as in fatty liver. So when there is fatty liver and there's a buildup of liver fat, we now know that there is a positive correlation of the ratio of firmicutes with bacteriolysis. We also know that bile acids are essential for fat solubilization, and dysbiosis results in the imbalance of bile acids, which in turn increases the permeability of gut microbiota and increased microbial growth. And we know that when you have pathogen-associated molecular patterns leading to inflammation, there is progression of liver disease. So in the area of hepatology, there's a lot that is happening, which with the knowledge that we are accumulating, we might be able to help our patients a lot. Several studies, human studies, prospective and otherwise, have shown us what we should do for all these patients. We now know that there's a definite connection between the gut microbiota and the heart. We know that when the trimethylamine, which is oxidized in the liver, gives the TMAO, blood pressure rises. There are changes in the vascular smooth muscle. Therefore, TMAO has become, which is taken from the blood, to assess cardiovascular risk assessment. There was a study that was done, reported in Nature in 2011, where they looked at 1,800 stable cardiac patients. They did an angiogram. They did the TMAO levels. They looked at cardiovascular disease and the plaque size. And they found that wherever there was a major adverse cardiovascular event, the TMAO levels were 2.5-fold increase. And this has now been seen as an independent risk factor. This is one of the studies that our team at Belivers is doing with our patients. Interesting to know that the gut microbiota plays a vital role in gestational balance. That means women who have gestational diabetes and preeclampsia are associated with a lot of bacterial diversity. Could this be an early marker? Can we test, look for bacterial diversity, which will then help us in patients with who come for delivery? And for me, it's a personal interest because my wife is an obstetrician, to see whether these earlier markers will help her in her practice. Women with endometriosis, with chronic pelvic pain and infertility. We now know that the gut microbiota has a favorable effects on the clinical, immune, and physiological parameters. So they are trying out probiotics in patients with pain. And as you know, endometriosis gives a lot of pain. If adjusting the gut microbiota composition relieves them of the pain, that will be a tremendous progress that we make. Dysbiosis in the gut microbiota can be involved in the regulation of fat storage, leading to obesity and metabolic disorders. And there is also a thought that it can have a role in reducing tumors, cancers. So maybe the microbiota, the gut microbiota end products, what we definitely know is that Helicobacter pylori has a role in the causation of CA stomach. Genotoxic Colibactin producing E. coli have a role in colorectal cancer. Bacteroides has a role in CA prostate. Increase in bacillus, decrease in lactobacillus in breast tissue have reported to have a role in CA breast. So when you look at metabolites in cancer, there are those which decrease the risk, there are those which increase the risk. And we also know that the disturbance within the brain-gut microbiota axis can result in stress-related disorders and in psychiatric disorders as well. So gut microbiota dysbiosis can cause chronic inflammation, and chronic inflammation can result in dysbiosis. It's a bidirectional interplay. So we also know that there are interactions like this between the drugs and the gut microbiota. Going back to that original slide that I showed you, we now have enough information about microbiota, the diseases that it causes, connected with just about every organ within the body. So what is the way forward? How do you look at the gut microbiota with greater effect to look at the way forward as part of this clinical revolution? Are there ways we can predict disease? Are there ways we can intervene? And in order to predict, we're looking at new hypotheses. We are looking at therapeutic development and clinical research. We are looking at experimental validation of various hypotheses. And we are also looking at hypothesis generation, which is data-driven. There are two approaches. One is the bottom-up approach. The other is a top-down approach. There are the DNA-based approaches, which earlier we talked about the metagenomics. There are the RNA-based approaches, which is the metatranscriptomics. The protein-based approaches, which is the metaproteomics. And the metabolite-based, which is the metabolomics. So using all these methods, which are high-intense work, expensive, but we should, in the near future, through either the top-down approach or the upward approach, we should be able to have answers, because we can intervene with prebiotics, which is dietary fiber to fuel the beneficial bacteria, or the probiotics, which are live bacteria to support gut health, the synbiotic, which is a combination of synergistic and prebiotics and probiotics, or the postbiotics, which are the metabolites that we have. And there are a whole lot of studies that have used probiotics in GI disorders, many of them fairly successful in various conditions, like antibiotic-associated diarrhea, inflammatory bowel disease, and H. pylori infection. And several more studies are in the offing that are coming up for us, so that manipulating the gut microbiome for better health has become the way forward now through probiotics, engineered microbiome, the fecal transplant, or various therapeutic options. That is where all of you come in. The diet and lifestyle, how much of prebiotics do you use? And then also, of course, with the teaming up with the medical world, look at what are the therapeutic measures that are possible and the vaccines as well. So for the gut microbiome, in order to predict, you have the characterization, looking at the composition, the functions, and to intervene, you have various ways of dietary modification, the prebiotics, the postbiotics, and the probiotics, fecal transplantation, and bioengineering. Thank you very much for your patient listening. I hope lots of studies will come out of all this so that we have many more answers and that we can help our patients to do extremely well. Thank you so much.
Thank you so much, sir. It's a wonderful presentation. We started with the very simple aspects like setting the curd at home and using it the correct timing to get the maximum number of microbes from the food, to like more advanced and research-based things like metagenomics and all. So thank you so much, sir, for your time and very patiently and dedicated manner you explained everything. We have a couple of questions. Shall we go through that, sir?
Yes, yes.
Okay. The first one is, can you see here? The enteric nervous system contains more neurons than the spinal cord. How does the ENS maintain its autonomy while remaining in constant communication with the central nervous system, as it is the second brain?
We don't have enough of an answer on that. What we now definitely know, and just see that question. Yeah. Yes. What we definitely know is in terms of the possibility of a connect. We don't have definitive proof on this. Right now, with the knowledge that we have, it is as if both are functioning independently. But I'm sure sooner or later we'll find what is it that connects the two. For example, when I have a stressful condition, I definitely now know that my stomach and my intestine function differently. Okay? How does that connect with the central nervous system? We don't have enough answers. But you must also remember that this is something that will need high-end research to prove it. It's going on in several centers. We'll have the answers, I'm sure, in a short while. Jyoti, is that okay? The second is, how do antibiotics impact gut microbiota? How can we restore balance after antibiotic therapy? Is that the second question?
Yes, sir.
Okay. So what we now know is that, and I'll take the example from my own specialty. When you have a patient coming to you with liver disease, the gut is full of bacteria. As long as the bacteria are in symbiosis, living happily together, that includes two things. One, the number of bacteria, number of organisms, let me say. And the second is the relative composition. If both these are normal or in a symbiotic state, you're fine. But when the numbers increase, or when the numbers of certain organisms are more than it should be, then you are in trouble. So what do you do at that point? And that is why I said rifaximin has been a wonder drug. You give them a course of rifaximin. Essentially, you're clearing out the gut. You're getting rid of all the bacteria. And then you replace it with probiotics. And this is where I advise all my patients to use the curd, which gives plenty of effective bacteria. So the answer to your question is you have to clear the gut first, and then you replace it with good bacteria. How does gut dysbiosis contribute to sepsis and multi-organ failure? Yes. When you have organisms within the gut, in the case of liver disease, what happens is produces a lot of ammonia, and that bypasses the liver and goes to the brain. And then you get what is called encephalopathy. You're not clear in what you're doing, and finally they go into coma. The second part of it is what the human body has is a natural filter which prevents organisms from the gut from getting into the blood. When you are sick, when you are in septicemia or going into septicemia, when you are not doing very well, the organisms from within the gut pass this barrier, get past this barrier and get into the blood. Okay? And then it is when organisms are in the blood, it is septicemia. How is the gut microbiome altered in critically ill patients? Yes. In the ICU setting, what happens is this whole thing goes haywire. And you may need to cleanse the bowel completely to ensure that you are not adding on to the problems. So, most of these patients who are critically ill will be on antibiotics, various antibiotics, which will then clear the bowel. And it's for us to ensure that the normal gut microbiome happens. Can we give natural probiotic and probiotics for SIBO? Is that, sorry. Will that worsen the symptoms like bloating? So when you have patients with SIBO, it means one of two things, either or maybe both, that the quantum of bacteria within the small bowel has gone up significantly. We need to get rid of that. Or it may be that the type of bacteria, they are not in symbiosis. So for both this, the way to treat is a simple method to clear the bowel. And that we do by giving a local antibiotic called, anyone? Rifaximin. Okay? We used to use norfloxacin, we used to use bigger antibiotics. Now, rifaximin is a local antibiotic and therefore it doesn't cause any systemic effects. So when you get rid of the organisms that are either increased in number or in various ratios different from what it should be, the way to do it is to cleanse and then supply the organisms in the right dosage. Could you please explain why the villi surface area is low for Indians? Yes. What happens within the small intestine, the jejunum mainly, is you have these villi like this. Okay. So the villi faces the lumen, and the absorption happens from there. So that's called the villi, and the area below is called the crypt. So when we, in our country, the villi get acted on by the large number of organisms that are present. And they have a deleterious effect on the length of the villi. When you go to European countries, when you go to the first world, for example, the numbers are less, the types are less. So the answer to your question is why the villi surface area is low in Indians is because of the large number of organisms that we entertain and the type of organism. Just to give you an example, if you go into the UK embassy in Chennai, when you go into the washroom, it will be written there saying that this is not drinking water. The reason why they write it there is because even within the pure water that we supply, there are organisms. Okay? Shane Warne, the great Australian cricketer, when he once came with the team and he was in Mumbai waiting for his cricket match, he went down with the Bombay belly. So everybody was concerned that despite being in a five-star comfort, with the kind of food that only is served in five-star hotels, he still developed the Bombay belly. Now that's something that we must accept, that the purest water that we have will still have organisms. There are emergent studies showing fermentation enhances mineral bioavailability. Do you see traditional soaking and fermenting practices as potential strategies to address hidden hunger in our population, especially? Definitely. Sri Priya, we don't know enough about this yet, but millets certainly will be one of the ways in which we will be able to answer the emerging problems. Definitely millets is a big thing that is going to come up for the future. Yes, the second question about the gut microbiome as a regulator of host risk. There's enough data now to show that one of the things that I learned when I went for my training in Sydney for liver transplantation was we always had a dietitian with us as part of our team. This is where I'm hoping that Jyoti and her team will do rounds with us, because advising patients on the proper diet so that they all have the right kind of gut microbiome, which will look at micronutrient deficiencies, which will look at the macronutrient deficiencies, and certainly I think a lot of the answer will come in the coming years. How do we differentiate between the effects of probiotics, prebiotics, and the symbiotic in clinical outcome? At the moment, we still don't have enough data to differentiate, but with the studies that are ongoing, in the coming years, certainly we should be able to differentiate. At the moment, we are struggling with ensuring that we supply enough, but the answer to your question is we don't have enough data yet. Can curd consumption be considered a reliable probiotic intervention in managing conditions like diarrhea? This is what we are studying at the moment. We know that in patients who should get a reasonable supply of good bacteria, we are now sure that curd is the answer. But will I give it for a patient with diarrhea or with antibiotic dysbiosis. We are in the process. The group in Bhubaneswar is studying this, and we will get data in the next few months. What is the optimum quantity of curd? What I tell my patients is 1 glass of curd. And I think that should give, now I have not quantified it, but certainly 1 glass of curd is what I recommend for patients on a daily basis. Is there a role for preoperative gut conditioning using fiber-rich or prebiotic diets to improve surgical outcomes? I have to speak based on my gut feeling in this because the studies are only ongoing. We don't have hard data to prove this, but I'm very sure that preoperative gut conditioning definitely will give us better surgical outcomes. This requires a huge study with a whole large number of surgical patients of the same kind. It's a good study for us to do. Gada Gopal, please encourage wherever you are, encourage our doctors to do a study on this. Definitely, it's worthwhile looking at it. And Jyoti, have you come across the use of postbiotics in your clinical practice? In which conditions do you? Oh. Yeah. So, Jyoti, I have not, this is again in the realm of speculation. We've not done this in our clinical practice yet. We're not doing it in Belivers, but certainly this is something that we want to do. And I hope you'll help me do this in our patients in Belivers. Is that all right?
Thank you so much, sir. I think sir badly needs a water break now. Please go ahead, sir. Okay. So meanwhile, let me invite Dr. Sri Priya Shaji, our founding trustee, to give the vote of thanks.
Very good evening, sir, and all the participants. I'm really happy to see maximum participants joining on the Vishu Eve. I have that as a particular concern in my mind, like everybody should join. I was praying that many should get this valuable education because I have not really taken your sessions earlier, but I have heard a lot about you. I work with Dr. Chandani Sajeevan in clinical trials, present principal of Wayanad Medical College. So, ma'am used to always say, Shri Priya, you have to come and see the Belivers research, and everything is way ahead. We must at least go there and see how we can build one for North Kerala. So, I have heard a lot about you and your team already. So, it is really a privilege and honor, and it is really a wonderful moment again for CNF to have you on with us for this Dietopedia, the initiative we started 5 years during Corona for empowering ourselves with the current updates. So thank you so much, sir. I sincerely thank you for this enriching session, especially like you started from the very beginning of structural understanding and you have evolved into the gut science and microbiome so intricately into nutrition and microbiomes, how it is connected. Like I'm a person who is very much interested in microbiology because of my professors, and today I am evolving into psychobiotic research and all. So this is kind of again wonderful session for me personally, and I hope all the entire CNF team must have got a wonderful insights from you. I sincerely thank the entire team of organizing team, that is our present office bearers, inclusive of Sharon ma'am, Uma, Jyoti Krishnan. We have two Jyotis and Sonia. So excellent. We have a wonderful speaker as part of our session again today in this. And we would also love to have Madam on our session once about her GDM studies and all those things. We'll get connected with Jyoti for the same. So this is a beautiful moments. Thanks for the organizer. And I also want to thank Nissi and Dr. Jyoti Krishnan for connecting with sir and making this possible for us. And for all your knowledge, I just want to share our next session flyer. I humbly request sir and everyone to join this Nutrilog that is going to be, we have something called Meraki, the research and development, where we are trying to do nutrition research from the community and public health perspectives. So the Meraki is entering into the third year, and this is our second anniversary poster, and that is on Nutrilog, the discussion very uniquely based on nutrition research. I humbly request you to join us if your time permits you. And I also request all the participants to join us for the Nutrilog and get a wonderful feast again as today. Thank you so much, sir. Thank you, every participants.
Thank you, Sripriya, Uma, Sharon, Jyoti, Nissi, all of you. Thank you for the privilege. It was great being with you.
If possible, we can take a screenshot. Like everybody can open your screens. It's a privileged moment to have Sir with us.
Sir, we wish, like you, all our Kerala doctors support our dietitians to join the medical team for the rounds, and our participation is very important. And to be frank, as you know, like many of the doctors don't encourage that participation. So it was really happy to hear you asking Jyoti to join you for the rounds for even the minute details. So hoping that in the coming years, our Kerala medical team will understand the value of dietitians, and we are eagerly waiting for our nutrition council also to come soon, so that we'll get importance for our profession. Thank you so much, sir, for the support and joining us today.
Thank you so much, sir. Sir has actually asked us to be the center of excellence in nutrition.
Okay.
So we are striving for that. Thank you.
Good. And we have a very good team lead to lead the dietary department, Jyoti.
And I think we should think of a multi-centric study with all this in mind. All of us joining together with our expertise will give us many more answers.
Okay.
Thanks, Jyoti and Nissi. Uma, thank you very much.
Thank you so much, sir. Hope to meet you soon in person. Thank you, dear all.
Thank you.
Happy Vishu to all.
Yeah, happy Vishu. All right.